Hello, this is Axel Hauschild. I'm a professor of dermatology. I welcome you to summarize the data of a clinical trial which was presented by myself at ASCO 2020. This clinical trial is COMBI-AD, a randomized phase 3 trial which was comparing dabrafenibe and trametinibe with conventional dosing over 1 year with a matching placebo. The trial has been performed in stage 3 melanoma patients. The trial comprised stage 3A if the central node had a diameter of at least 1 millimeter, stage 3B and stage 3C according to AJCC 7th edition classification. 870 patients have been treated and 1-to-1 randomized. And the first data have been released after an almost 3-year observation period, and they have been published in the New England Journal of Medicine in mid of 2017. At this point of time, we released a hazard ratio of 0.47. This is a 53% improvement of relapse-free survival for the primary endpoint. This means dabrafenibe and trametinibe increased the relapse-free survival by 50%. Also at this point of time, distant metastasis-free survival was released with a hazard ratio of 0.51, so very much in the same range. An excellent results, a 50% improvement for distant metastasis as being the first site of a relapse. 3 years ago, we released also overall survival with a hazard ratio of 0.57, a 43% improvement of overall survival. But I need to say that there's no update to the final analysis of COMBI-AD, which is expected to be in about 2 years. Also, we have not updated the toxicity data because none of the patients is on treatment right now, and most of them had discontinued the treatment a long time ago because we have a 5-year observation period now, and patients have been treated for only 1 year. So I can talk about an update after 5 years for relapse-free survival and for distant metastasis-free survival. But I want to say that almost a year and a half ago, we have also released the so-called cure rate model, the Bible cure rate model, which showed a 17% improvement of the chance to be cured. I think this is something we should have in mind if we discuss now the distant metastasis-free and the relapse-free survival. Let's go with relapse-free survival. And now we have a hazard ratio of 0.51, almost the same as 3 years ago, so the curves are very stable, and only 2% in both groups, in dabrafenibe and trametinibe and in the placebo group, progress between year 4 and 5, which means the curves are flattening, which is a very good sign and which speaks for the ability to induce cure by dabrafenibe and trametinibe. 52 patients are still relapse-free, in contrast to 36 patients in the control group. For distant metastasis-free survival, as expected, the rate is even higher. And there's also a clear delta between the two curves of dabrafenibe and trametinibe and the matching placebos. And here the hazard ratio is 0.55. So you see that in the last 3 years, there's almost no change in the hazard ratios, which speaks again for the durability of the efficacy of dabrafenibe and trametinibe over time. And now we hope that the overall survival in 2 years from now, corresponding to all the other updates in 2 years from now, will show a meaningful improvement of overall survival. But we should have in mind that the overall survival, in contrast to relapse-free survival, is impacted by all the salvage therapies. And now I'm coming to the last point. Of those patients who had a progressive disease under the treatment with dabrafenibe or placebo, dabrafenibe, trametinibe or placebo, or those who had after the adjuvant treatment a progressive disease, of those patients who had relapsed, the rate of patients who were treated systemically is almost the same. 79% for patients with dabtram compared to 77% in the placebo group. And of note, most of the patients received some sort of immune checkpoint inhibitors, ipilimumab alone, PD-1 alone, or ipi and nivo in combo. We have no data how they responded, but we have the pattern, which patients got which treatment. But there was also some patients who were treated with dabtram who got a re-challenge with BRAF and MEK inhibitors. And for sure, patients who were treatment naive in the placebo group after unblinding, they received particularly dab-tram in second-line treatment after the placebo treatment. So I can conclude that this is a very meaningful result and the longest follow-up of all the clinical trials from the new era. And I can only congratulate the clinical trial team for evaluating the data in the last 5 years so clearly. And I like to thank you for listening. Obrigado, take care, and all the best for you.